Welcome back. You're still watching The Breakfast Show. Now we're moving on to our second topic, and this is more of a health cosmetic issue. We're talking about aging and wrinkles. Of course, this is something that happens both to men and women, and no one wants to have wrinkles at an early age, especially for women. Unfortunately, this does occur to people even at young ages. So we're going to be talking about this issue, the problems of it, the causes, and how we can avoid aging and having wrinkles at a young age. And we're pleased to be joined by Dr. Munir William Labib, who is a professor of plastic surgery. Good morning, sir.
Good morning.
Good morning. So the obvious question here is, what causes skin wrinkles and lines?
Of course, there are many changes which occur in the skin and subcutaneous tissue, which end all these causes by aging and wrinkles. For example, the ability of different types of cells to division decreases. Also, the ability of fat cells and sweat glands to divide decreases. Also, there is precipitation of low-density triglycerides in walls of capillaries and blood vessels, which ends in atherosclerosis, which affects mainly the skin and subcutaneous tissue. Also, we find what is known as chemical mediators, which are present at the nerve endings, which are responsible for transmission of any orders from brain to different parts of the skin. These chemical mediators, such as acetylcholine, such as adrenaline and noradrenaline, all these decreases inside the body. Also, the efficacy of the central nervous system decreases. All these by aging, of course, all these by many other causes which affects these change. For example, those who are smokers, bad habits such as smoking and such as alcohol and so on, this affects this aging and promotes the effects and the appearance of these wrinkles. Also, we find the disturbances which occurs in women in the menstrual cycles also promotes this. Also, the presence in these bright lights and so on, this may promote and increases the appearance of wrinkles. Also, we can find patients who are going severe regimes and who are going diet control. All these types of diet controls also can promote and helps increases the appearance of wrinkles. Also, persons who are operated by severe operations which for obesity, such as application of ring in the stomach, such as gastric stripping, or such as bypass operations, all these operations end in appearance of wrinkles quicker in elder age, in younger age than quicker.
So it seems that there are a lot of reasons that could cause wrinkles at a young age, but how can we avoid getting wrinkles at a young age, and how can we fight this? I mean, I've heard that there are creams and whatnot that people can use at a young age, but is this the only solution? Is there a more natural way to avoid wrinkles? And if not, and if the creams are the only solution, are they safe to be used at a young age?
I disagree with you that creams are the only solutions, because many creams that promote the appearance of wrinkles. Creams which are not moisturizers, creams which are makes the skin more stronger, these creams for sooner or later will lead to appearance of wrinkles, the reverse of their efficacy. Also, and prophylaxis can pass in the following, can pass in taking vegetables which contains vitamin A, which is the cement of the skin. So vegetables, lots of vegetables can prevent appearance of wrinkles. Also fruits which contain vitamin C, which is responsible for the blood capillaries and blood vessels, which makes it stronger. They decrease the appearance of these wrinkles. Also, the bad habits such as heavy smokers, such as alcoholics, all these can, restriction of these habits can decrease or delays the appearance of wrinkles. Also, the work itself, for example, severe lights in studios, also severe regimes for persons. All these, the appearance of them can affect the wrinkles.
So what's the appropriate age to start seeing wrinkles, and what's too early? And for instance, can a 20-year-old get wrinkles?
Of course, here I can differentiate between the normal aging, which is my age and your age, what is written in the birth certificate, and what is known as biological aging. Biological aging is related to organs. For example, a person who is heavy smoker, the biological aging of his lung is elder than his normal aging, which is written in the birth certificate. Also, the patient who is suffering from bilharziosis, for example, we find the biological aging of the renal bladder is more elder than his age, which is written in the birth certificate, and so on. Here we have to differentiate between the biological aging due to disuse or misuse for certain part of the body and the normal aging, which is written in the birth certificate.
And I mean, speaking of wrinkles and how people can avoid them, some people use laser surgeries and fillers like Botox and whatnot. How safe or how dangerous are these?
Oh,
Surgery.
yes, there are different lines. Let's speak about each line separately. For example, let's start by peeling. Peeling previously was we use what is known as phenol, but phenol was very dangerous because its general efficacy on the body, so it is prevented. Then there is peeling by what is known as TCA, which is trichloroacetic acid, and there is peeling by more recent is by glycolic acid. This peeling is very important. It affects the skin. It can treat superficial wrinkles only. And the wrinkles has many problems with dark-skinned people, persons such as we. So peeling is better to be done in white-skinned people and white-skinned persons. So peeling has a line of treatment which is up to 5 to 10%. But we don't forget that there are certain types of fruits used in peeling, and the housewife in the house can use it, such as peeling by fruit peeling. Certain types of fruits, such as lactic acid, which is present in milk, or glycolic acid, which is present in canned sugar, or any acid which
These are like natural homemade masks.
Yes.
And these are not dangerous at all.
This is not dangerous, but we use certain types of fruit acids in very low concentration. And they are better to be used by certain under medical supervision. And for my own opinion, peeling plays a very small role in treatment of wrinkles. It's up to from 5 to 10%, and it treats only superficial wrinkles.
Is it short term as well?
And
I mean, does it only stay for a very short time?
Yes, for short time, from 3 to 6 months. Second type of second line of treatment is laser, use of laser. There are different types of laser. Previously, we used what is known as carbon dioxide laser. Then we used what is known as RPM laser, which is CO3 laser. More recently, we use what is known as Fraxil laser. It's a certain type of carbon dioxide laser. All these types of laser, they deal deeper with the skin. They are deal with glycogen. They are dealing with collagen. They make the collagen to become more stronger, and it becomes more fibrotic, so the skin becomes more stretchy. So use of laser is better than use of peeling, but it takes very short time also, from 6 months up to 1 year. And also it is forbidden to be used in dark-skinned persons, such as necros and dark skin, but it's better to be used in white-skinned persons, with some restrictions can be used in brown-skinned persons.
So if you have a patient right now who has wrinkles, would you go for a less invasive sort of style treatment, for instance, the peeling and the laser, or would you recommend plastic surgery right away? Because it seems this is the easy way out for many doctors.
Of course, plastic surgery comes as first choice for me. And plastic surgery passes in 2 ways. The first way, what is known as fat injection. Fat injection is a special type of fillers. We have to perform operations such as liposuction. By liposuction, we have to take fat either from lower abdomen, we can take fat from upper or inner or lower parts of the thighs, or even from the haunch. This fat is emulsified under complete sterilization and re-injected inside the face. In the face, we inject by 7 needles. 2 needles are present on both sides of the nose for filling of the nasolabial fold. Another 2 needles are coming here, both of the outer angle of the eye, to fill the cheek area and the lower eye area and in front of the mandible. The third 2 injections comes here from both sides of the mouth for the upper lip and lower lip and part of the chin. The last or the 7th injection comes here for the lines on the forehead. So this operation is an easy operation. It takes less than 15 minutes, but under complete sterilization. And of course, the fat is taken from the person and injected in the same person. So there is no way of rejection, and it lasts for a long time. For my opinion, a boy is 40 years old and has done fat injection. It has to last for 40 years more, because you have to replace the fat which is taken, which is done through the previous 40 years, and it has to last for next 4 years. So it is one of the best operations to be done. The second operation for me as a plastic surgeon is facelifting. And facelifting we divide for us as a surgeon, we can divide face into 3 areas. The first area is facelifting for the forehead and the upper eyelids. The second area for the middle of the face, which is important for lifting for the cheek and the lower lid and the part of the upper lip. The third of the mouth of the face is for lifting of the chin and for the lower lip. Any surgeon can operate the 3 operations together and can do the first, third, and and so on. So the control for us is the patient himself. What are the deepest wrinkles present in his face and how to deal with this. And for me, this operation is preferred for those who leave their face for longer periods, who are coming with sagging of the neck, with lowering of the cheek, for wrinkles below the eyelids, wrinkles before and the eyelids, and so on. And this is, of course, the best operation to be done and to be operated.
And lastly, before we end the segment, I just wanted to ask about the dangers. I mean, are there dangers in either the fat injection or the facelifting, and how often could someone use this? Because I mean, we see pictures of people who keep doing it over and over very often, and their face looks very messed up and very unnatural.
Of course, every operation to be done has many dangerous side effects. For example, fat injection, if there exists fat is present inside the body, we find the face looks as if it is mask face. And of course, this needs more maneuver to be done. As for side effects for facelifting, the dangerous one is the facial nerve, which is present in front of the ear. This facial nerve is very dangerous and very serious. If it is cut or if it is just touched, it may lead to dropping of the angle of the mouth or may lead of non-closure of the eye. Of course, these operations need special experience and not anyone can be done, of course. But for my own opinion, still plastic surgery is the best line of treatment and forever it will remain so.
But people definitely should be taking care and making decisions. If they don't need them, then you shouldn't get them.
Of course, taking the decision is very important, and it is a relation between the doctor and the patient. And for me, I advise my person and my patient, and if he agrees, I go ahead. If he refuses, I'll stop.
Dr. Munir William Labi, Professor of Plastic Surgery, thank you so much for joining us.
Thank you.
And what do we have now, Rihim?
We're going to take a look at Taba. It's a small Egyptian town near the northern tip of Gulf of Aqaba. Taba is in the location of Egypt's busiest border crossing. So let's take a look at this future report.